Hello, I am Dr. Harini Sridharan, consultant pediatrician and neonatologist at Mazumdar Shaw Medical Center, Narayana Health, Bangalore. Today, I am going to talk to you about the introduction of complementary foods, also known as weaning, in your infant. Normally, the best practice is to breastfeed your child till your baby is 6 months. There may be times that we may require to introduce complementary feeds much earlier or later based on your situation. At this point of time, we always wonder what is the best diet that we can offer the baby or start with at this point. Generally, it is recommended to continue breastfeeding your baby up till 2 years according to the WHO guidelines. This is because breast milk is very important for the growth and the development of the brain of the newborn baby, and it gives your baby the best possible chance to go ahead in life. The complementary foods are normally introduced at a period of around 6 months. Sometimes you may need to introduce the complementary feeds much earlier based on either the general health or the condition or other issues such as the mother returning back to work. So generally, we recommend that during this stage, the complementary feeding is introduced during the daytime and the breast milk is continued at night whenever the mother is in contact with the baby. The first complementary foods given to the baby are usually those which are rich in calories and nutrients and form a complete or a balanced meal. These feeds can be offered in the starting around 1 to 2 times a day in small quantities, say a spoon or 2, and they can be slowly increased throughout the day. Eventually, you can feed your child up to 4 times a day, as much as your child takes. It is normal at the start for your baby to reject foods or spit up the foods or push out the foods. Sometimes your baby may not be ready to take in or swallow the food and may indicate so. And at this point of time, you can continue offering and not be bothered that the child is not taking enough food. Over the days or months, your baby may increase the quantity of food it takes. Some of the babies have a very active tongue thrust reflex in which rather than the tongue taking in the food, they tend to push out the food. And such parents usually find it difficult. In such cases, please continue offering small quantities frequently. You can also try baby-led weaning or self-feeding of certain foods in such cases if your baby is able to hold the head up and your baby is able to sit without support. So coming to the foods, what are the ideal foods to be offered as a part of the weaning process? There is no perfect food or ideal food to be offered. Generally, the food options are those which are traditional and are used as a regular part of your day-to-day diet. No one food or one diet is complete, and it is advised to give a variety of foods to the baby. These varieties may not be introduced all at one time, but sequentially, just in case that if your baby has any reaction to any of the foods, then it is easy to pick out and eliminate that particular food. Also very common during the period of transitioning from breast milk to solids is that a lot of babies develop constipation. And at this point of time, we recommend to give them foods which are more easily digestible, foods which are rich in fiber, and to start giving them sips of water in between foods. It is very normal for the baby to pass out undigested food in the stools, and this happens because they do not actively chew the food but swallow the food as a whole. This is not an indication of the digestion capacity of the baby, and this is something you do not need to treat with any medications or any other things to improve the digestion of the baby. It is very common for the baby to pass stools immediately after eating, and they may do so 3 to 4 times in a day. Generally, the acceptance of water initially is very less, as most of the babies continue to be either breastfed or formula fed, and that continues to satiate not only the hunger but also the thirst of the baby. It is generally advisable to feed your baby and also involve your baby at the same time you are eating food, so that they are exposed to a variety of foods and food as a whole and the process of eating becomes enjoyable. Please do not force your baby. It is not essential that your baby completes all the food which is present in the bowl, as this may lead to a food aversion and your baby may completely refuse to take food after that. Now, some of the commonly advised first foods are cereal-based foods. Commonly, these can be rice-based foods or wheat-based foods, or in some parts, ragi or nachni is used as one of the foods. Rice is usually given as a combination along with dal, as rice is an incomplete protein and the addition of pulses generally completes and gives it a balanced diet. Other fruits like banana, apple, chiku or mango, which are high in calorie, are also started as the first food. It is generally advised to fortify the food with either minimum quantities of salt, sugar, jaggery or ghee, as they not only improve the palatability of the food but also provide other nutrients and calories. It is very common that beyond a certain age, the babies do not increase the quantity of food. So at this point of time, we particularly suggest fortification by the use of ghee or coconut oil and the use of high calorie foods, as this will help in making up for the calorie and the nutrient deficit. Some other foods which can be given are dalia, suji, sabudana, khichdi or roti which has been mixed along with dal. Water to be given in sips in between. Cow's milk is generally avoided in the first year, as not only it can become addictive and the kids refuse to have any other food, also it is not a balanced diet in the whole. In general, mother's milk should not be replaced by any other milk till the age of 1 year, and we have to continue breastfeeding the baby. So this is a normal process of weaning of your child. It has to be done in a very gradual manner at the pace of the baby. Thank you.